Heroes may work on the front lines of the University of Vermont Medical Center, but in late October, it was online villains that took over the health system, with a significant cyber attack impacting 6 of its hospitals in 2 states, including hurting their ability to provide some cancer treatments.
They should expect us to be a little disorganized, honestly, and not as efficient as we are with all of our software systems on.
It's just the latest online ambush on a hospital already grappling with the global pandemic. In September, a massive malware attack of the Universal Health Services chain hobbled hundreds of facilities in 37 states and D.C., sending doctors and nurses back to working with pen and paper in scenarios where every second counts.
People's lives are at risk. So, these are serious consequences.
But cybersecurity expert Ken White says serious action isn't taken universally, with many hospitals and healthcare systems failing to adequately protect themselves.
Are American hospitals doing a good job of keeping these attacks at bay?
It really depends. I mean, we have so many shoestring budget, rural hospitals and community clinics and treatment centers where, people are doing the best they can with the resources they've got.
In a recent industry report, one expert said only about 4 to 7% of a health system's IT budget is for cybersecurity. And often White says that funding is allocated for upfront costs for technology and devices that are designed to last years. But if routine security patching, which updates and fixes vulnerabilities, isn't done, hackers can find a hole.
Even if most of your systems are patched, but maybe a handful, a handful out of hundreds or thousands aren't. The software is written in such a way that it kind of uses that to gain a foothold and then, elevate to being able to take over an entire network and potentially hold the, whole thing hostage, literally hold it hostage.
That means ransomware attacks where hackers lock hospitals out of critical systems until they pay up. It's a serious enough problem that Interpol warned about the potential back in April, saying organizations at the forefront of the COVID-19 response have become targets. The FBI issued a similar warning in October, and in a hearing just 2 weeks ago, members of Congress said the issue needs to be a priority in light of the pandemic.
It's clear to me that our nation's hospitals all need additional resources and support to be able to achieve their missions in the face of cyber attacks.
Attacks that experts like White say are not as sophisticated as you'd think. Instead, he says it's often hackers simply exploiting basic vulnerabilities that should have been fixed.
There are a lot of really bored, malicious people out there. It's a never-ending battle, and you just can't let up.
Healthcare systems staying vigilant, not only against a global pandemic, but cyber criminals trying to undermine their security. I'm Josie Sturman for Spotlight on America.